So won't you please welcome Dr. Brad Wajda.
Now, yes, I am connected. All right. Well, it looks like it's only being used a couple times. Okay. Well, hello. Elephant in the room, a spiritual assessment. I came up with this because, we're talking about stigma. And I love to see all these mental health folks who are embracing, as we heard this morning, that faith is an asset. I love that. Because it's true. See, from my point of view, I'm not treating the whole person if I'm not doing a spiritual assessment. Now, of course, we're also talking about all the other stigmas out there. We've talked about some of the stigmas that people have encountered with the church. I love the fact that this church is hosting this and that there's so many people in ministry that embrace the reality of what mental health treatment is, and they don't label it and they don't judge it. I will tell you a true story. There's the definition of stigma. And while we're on this slide, I'm going to tell you a true story happened to me. Summer of 2013. I was actually walking into Central California Women's Facility in Chowchilla. I was a psychiatrist there for well over 10 years, and then they asked me to come back and do some contract work. They stopped me at the gate and confiscated contraband. Do you know what contraband is? Contraband is not, it's something that does not belong in the prison. Contraband is something that, you could be arrested for. I mean, it is something that has no place in the prison. Do you want to know what my contraband was? My Bible. My Bible. 2 weeks after they just assigned 2 Wiccan counselors or chaplains, because we have to have them represented. And the captain had gloves on, and he picked up my Bible like this, like it was contaminated. And he began to mock me. Oh, you really need this? Well, those of you who know me know I just laid down to that. No. As a matter of fact, as I've said, I have a face for radio. The reason I have a radio show is because I want to remove the stigma from mental health. And so I said, well, if that's a Quran, and I needed to face east and do my prayers later, would you be treating it that way? Well, that just ruffled their feathers a little bit more. And I was required to take that out to my vehicle, given a receipt, written up, went all the way to the warden. And I'm confused. I thought Bill Glass took Bibles into the prison all the time. As a matter of fact, if you're an inmate and you've got a little magnetic plaque that says Bible, you put it on your door, they have to give you one. So then I heard it. You're a psychiatrist. This isn't part of your job description. You don't need this. As a matter of fact, it went to the point to when I said, well, we're going to talk about this on the radio. That they said, oh, we'll make an exception for you. We'll make an exception. Isn't that amazing? It's amazing what we run into. At the front end of this, like I said, ultimately I want to point out how important it is for mental health people to do a spiritual assessment, and we're actually going to do one on ourselves, okay? Before that, I'm going to show you some opinions, both from the church and from mental health, that gratefully aren't represented here. So we'll go to another slide. The negative is on the church side, it's a faith issue. In mental health, well, it's a crutch. That's just a crutch. Your faith is just a crutch. Let's see what else we got going. Dave Hunt. Now, this is a rather caustic gentleman who, here in this quote, Christian psychologists claim to have a firm faith in the inerrancy of Scripture, but no matter how firmly a psychologist adheres to the inerrancy of Scripture, they all must deny its sufficiency. Now, if I deny the sufficiency of the Word, I've just denied the deity of the Lord. And this Dave Hunt, I actually heard him say that psychiatrists and psychologists cannot be Christians. If you want to doubt my Christianity, don't do it because I'm a psychiatrist. Hey, do it because of my history. In 1990, I applied to a seminary. They asked my medical school for my transcripts. They didn't get them. They asked 3 times. They didn't get them. I called med school. They said, oh my gosh, it really is you. You are the last person we ever thought would apply to seminary. They said, we thought somebody was just trying to get your records. So it's true. So if we can go to the next slide. Jay Adams. The only professional known to the Scriptures is the pastor and the other elders of the church who especially are summoned to this duty. He's referring to counseling. Those of you who may not know, Jay Adams believes, that all you need is the Bible, regardless. I would never name names, and I say that on the radio, then I always name names, but I'm really not going to do that here. I had a pastor in the 90s who would ask to sneak members of his congregation into my office after hours because he was promoting Jay Adams, but these were the people that, gosh, we need something else. They're hearing voices. They're seeing things. He needed to maintain the facade for everybody else that, Jay Adams' professions of, everything is a faith issue were sound. And I can't imagine the amount of damage. I mean, I was just appreciative to be able to do for those people what I could do. We'll go to the next. John MacArthur. Wow. Professional psychologists are no substitute for spiritually gifted people who know the Word. Now, see, I beat up on the church. Let's beat up on mental health. Let's go to the next one. Now, this was published in something called A Reason to Believe, published online with the American Psychological Association. I do have to say that the overall intent of this document was supportive, but it was pointing out some prevalent thoughts of some other authors. It said, harking back to Sigmund Freud, some psychologists have characterized religious beliefs as pathological, seeing religion as a malignant social force that encourages irrational thoughts and ritualistic behaviors. We can go to the next one. And this is Stephen Reese, Professor Emeritus of Psychology at Ohio State University. People are attracted to religion because it provides believers the opportunity to satisfy all their basic desires over and over again. I don't even know what that means. I mean, if somebody knows what that means, enlighten me. I'm just a feller from Oklahoma. So, as we go to the next slide, I put this here. Karen, my wife, found this slide. I love this slide. There were times in our history when the most learned individuals believed the earth was flat. Some of these people can be great theologians. Their knowledge of the Bible can just be amazing. But all it takes is ignorance in one area. Wow, did I actually use a word that harsh? Well, yeah, I sort of did. Because the evidence is so overwhelming, it's amazing. I mean, we talked about it with genetics, we talked about it with neurotransmitters. I mean, it's an obvious thing. If I give you LSD and I tell you not to hallucinate, what do you think's going to happen? You're going to hallucinate, no matter how bad you don't want to. Go into surgery. They're giving you the sleep medicine, your anesthetic. Tell yourself, I'm not going to fall asleep. See what happens. The last thing you'll remember is 99, 98. Yeah, no. Go to the next. Clear evidence exists. We can go to the next one. This was sort of neat. It was if you know science, then there would be no stigma. So I'm going to catch up to myself in my notes. I've been rambling. So now I want to go to something just to show a sort of a prevalent movement. If we go to the next slide. Well, my slides are not quite matching with my brain. Scientific measures, we talked about neurotransmitter profiles, brainwave studies, that's huge. I mean, let's face it, one of the reasons there is a stigma is because it was a lot easier to see an irregular heartbeat or a tumor than it was to see a chemical imbalance. I mean, that's the mystery that's been locked in this bony vault that only technology could unlock. Now I have the ability to see what your brain is doing while you're alive. I can see a real-time picture. I can do a qualitative EEG, which is a brainwave study, that will give me this, in essence, 3D picture of the activity in your brain. I mean, there's so many things we can do. Next slide, please. Okay. This was interesting. My last picking on the ministry here. But Martin and Deidre Bobgan, they have this, their ministry labels mental health treatment as psychoheresy. And they're sort of interesting. On the next slide, do we have a quote from them? No. So I'm going to read you the quote that I have. They said that people who argue that you go to a medical doctor for a medical issue and then you go to a psychologist for a psychological issue is an error in logic. It's a category error because they don't see that the two are one and the same. And like I said, the amount of damage that's done by leading people astray is sort of amazing. The Bible has many examples of medical conditions where people were healed, but healed by casting out demons. But they were medical conditions. There were also other medical or healing situations that I feel like served as endorsements for medication. So let's take a look at them. In Isaiah, at God's directive, prescribed a poultice for Hezekiah's boil, so he'd live another 15 years. I mean, I don't think God needed to make a poultice. In fact, I know he didn't. I mean, that healing could have just happened like that. What was up with the symbolism? Was it trying to show us that we use our resources that God has given us for healing? In John 9, the blind man, and I think this is great. Jesus said, neither this man nor his parents sinned. Then Jesus spat on the ground, made the clay, and put it on his eyes and said, go wash it off. After that, he could see. Did Jesus have to use clay to do a healing? Symbolism. It's symbolism. Let's go to the next slide. We've sort of already talked about this. Medical problems have been easier to see and understand, so we can blow through that one. A lot of people have said different things like this throughout the day. Imagine if you got blamed for cancer. We've heard that. This just, another way to drive it home. We'll go to the next slide. So, at this point, I want to talk about the importance of why a mental health person needs to pay attention to your spiritual belief system, where you're at spiritually. I mean, it's amazing to me the number of therapists that I come into contact with, people that have even come to me for a job. And I said, well, let's talk. If you have a patient come in and they present with these issues, what would you talk about? And I asked them specifically, how would you do a spiritual assessment? Oh, I wouldn't go there. We don't talk about that. I mean, in this day and age, I will tell you, more often than not, they tell me they're not comfortable with that. And I don't know how, when you consider the fact that a person's faith should be the center of their life, how you could ignore that. Your worldview is defined by the belief you hold about the origin, purpose, and destination of your existence. If you haven't assigned an identity and a purpose to the world around you, the framework within which you live, how are you going to formulate an identity and a purpose with any permanence about yourself? Doesn't that just make sense? I mean, it's amazing how many people are there. It's actually a search for identity and relevance, purpose. And that's their unhappiness. Now, some people say, well, okay, there's the faith issue. Well, they're not. We're talking the difference between them being discontent with their situation or them having a mental illness. I want to remind everybody here, your emotions, your thoughts are all mediated by electrochemicals that are either positively or negatively charged. That's why you're not going to be able to escape hallucinations if I give you LSD. So we talk about what is your worldview. We'll go to the next slide. So the questions I ask people are, where do people collectively come from? Where did the human race come from? Where do people collectively go when they die? And the most important one is, why are people collectively here? That's going to define your worldview. I have so many people who tell me I don't have one. Well, I disagree. I think we all have one, even if it's by default. A default worldview is going to be one where you're going to take part of the belief system that you grew up with, and you're going to marry that to whatever belief system you need to have to justify how you're living right now. But those people that's a big identity issue, because I just don't know where I fit. I don't really know what my purpose is. I'll figure it out. The old Scarlett O'Hara, I'll figure it out tomorrow. So I want to hold on this slide for just a minute and talk about, I've mentioned to people about genetics, neurotransmitters, vitamins, hormones, all the things that can affect somebody's mood and mental health. When I get to the end of that, and I can't really find anything, I can't find a reason. It's not bereavement, it's not that chemical imbalance, then in my experience, what I find is that's that person who's not living congruently with their worldview. I mean, let's go to the next slide and see what I've got here. Okay, after ruling out all other causes, what I find is anxiety is the fear of the unknown. Depression is the negative anticipation of the unknown. Anger is the reaction to a sense of losing or having lost control. Now, when I talk about being congruent, you listen to what a person's worldview is, and you see if that worldview jives with, okay, let's say fear of the unknown. Well, if you have a faith that sort of tells you who wins in the end and how the story ends and so on and so forth, that's the closest thing I can find that comes close to a faith issue. However, I told you earlier, your brain is an adaptive thermostat mediated by neurochemicals. And you want to correct situations like that before your brain adapts and says, wow, this anxiety must be the set point, must be where we need to be all the time. Because at that point, we have a chemical imbalance. Let's go to the next slide. So how do we lose congruency? Well, when you're born, that's the widest angle lens you're ever going to have. You're looking at everything brand new. You're a blank hard drive. As you age, you get interest. The angle on your lens tends to narrow. Ideally, you would hold your perspective so that you remember what you're looking at. Oh, well, on that previous slide, sorry. The bottom half of that is sand under a microscope. I mean, obviously it's sand on top. When you look in a microscope, you don't start on the highest power, you start on an observational level so that you know what you're looking at, and then you retain that perspective as you dial it in to a higher magnification. And ideally, that's what you do with your worldview as you live your life. You're going to have interests, you're going to have things that tend to narrow your focus, but you never want to lose your perspective. Now we can go to the next. This is another picture of perspective. If you're looking at the magnifying glass, you'd probably never guess that's toilet paper. But, and then the next slide. Just another example. As a pilot, I'll be the first to tell you it's really easy to get lost in Central California because this whole place looks the same from 2,000 feet. So what are lost procedures? Well, if you don't know where you're at, you climb. Because as you climb, you get a wider perspective. Then all of your landmarks start to get back into perspective. So here's perspective, because that's where we are right now. That's actually an aerial view of where we're sitting. Because when you get that high up, then you know where you're at. So you need to, that's how you lose your congruency, and to get it back is you just need to do that spiritual assessment. Figure out what your worldview is. You ask yourself those three questions. What do I believe where people collectively come from? Where they collectively go, where they die, and why they're collectively here? Now, as Christians, the Bible tells us the answers to those questions. Do we believe it? What we need to do when we look at our worldview is make sure that we have volitionally sat down, reviewed it, and that we can intellectually satisfy ourselves with what we found and believe it. Because once you do that, that changes your entire perspective. I think my next slide, yes, my bicep. First slide I've been right on. All right. I use this as a model for therapy. I want you to imagine that your core self is the hub of that wheel. Your life is the rim. When you're going through therapy, traditionally, you'll be addressing all those points out there on the rim at the end of each spoke. Marital issues, job stress, maybe disappointment in yourself, whatever those are. And, therapy's a process. You can see that you're making little gains as you go along. Sometimes you're at risk for relapsing and having to jump back. But my argument is, if you go to the core, what your worldview is, and you make sure that you are congruent, you make sure that you have volitionally chosen a worldview that intellectually satisfies you, then that's going to radiate out all those spokes and change your perspective on everything. So we'll go to the next slide. So I put the footprints in the sand because it was important for me to leave you with, I am hoping that mental health professionals globally recognize just how important it is that we do a spiritual assessment on our patients. I mean, yes, I am a born-again Christian. The way I answer that spiritual assessment is the Lord created a free will being to exist in an adversarial environment, to make a choice to follow Him, to go on to be the bride of Christ. I live my life by that. That's volitionally pursued and intellectually satisfying. You know, some people, you know, they need to address that. Because, again, as a born-again Christian, it's not my role to evangelize during treatment. I'll have people bring a lot of different worldviews to me. However, it is my job to point out obvious flaws in their logic or obvious things that they're missing. Because if they don't deal with it now, they may come up later. That'll be an issue later. Well, gosh, you know, that doctor was asking me these things, but, you know, I kept telling him I believed that a toaster was responsible for the universe. And now I'm finally realizing that the world existed before there were toasters. That just doesn't jive with me. So, you know, I'm not going to, but like I said, recognizing a person's worldview determines their perspective on life, their priorities, and their goals is crucial to us as a mental health profession. That is, in my opinion, one piece of the two pieces of stigma that we've been talking about. I'm talking about it from the mental health side. We've been talking about it from the church side. And I love what I'm seeing from the church side. So that's about it in a nutshell. So. I've ran into many a gang member who's now in ministry, doing really great things. I was a psychiatrist for women's death row for 10 years. You know, I will tell you that, you know, a lot of things can happen. There are people who are products of really awful environments. And they learn coping skills and moral standards that are appalling. But, you know, the issue is being able to reach those people. The issue is being able to get them to a point where they're at least willing to consider there are alternatives. And like I said, I've seen some people, you know, again, myself included. You know, when my medical school said, "Wow, you're the last guy we ever thought," as funny as that is, I would have to agree with them. So, yeah. Yes, sir. He was asking about Celebrate Recovery and what, in terms of talking about the church's opinion on mental health treatment, just, you know, what my opinion is about them. Is that in essence what we're talking about? Strengths and weaknesses. You know, I would have to, I don't know their policies. You know, peer counseling, peer support groups usually depend on the peers. So I tell my patients this. I say, you know, I am all for you going to a peer support group, a 12-step program. But the instant they start telling you something that contradicts what you hear from your therapist, I want you doing an about-face and taking 12 steps the other way. Because, you know, people find things, especially in Celebrate Recovery, that work for them, and they're human. So they think, well, if it works for me, it's going to work for everybody. And of course, we all know better than that. I mean, the world's full of that kind of thing. And so, they start imposing that on people. So I try to give them that out. Say, I'm all for that. But if it starts contradicting, then you need to walk away. Oh, the radio show. Well, it is on Christian Talk Radio. I do have to tell you that. It's on 1680 AM, Saturdays at 1 o'clock. I also believe that the Lord does have a little bit of a affinity for maybe PG-13 humor, so I'm warning you. We always tell people when they tune in that it's time to get the kids out of the room. But I blame that on my wife being on there with me. So. Transcranial magnetic stimulation. Well, I've taken, Ron's I'm going to pick on him. So let's say Ron's not doing good, and we've checked his neurotransmitters and they're fine. And we've looked at his blood work, and even though it looks like an old man, it's fine. And so we look at all this stuff, and I can't really find out what's going on. Then it is likely that down-regulated brain tissue. In other words, the brain is an adaptive thermostat. And it's going to say, wow, if being depressed is the set point, that must be where we're supposed to be all the time. Let me give you an example. If I walk up behind somebody and I scare them, they don't stop and go, okay, heart race, break out in a sweat, start shaking. All of that just happens automatically because the anxiety is a neurochemical pattern that just sets off a cascade of things. Depression, the same thing. So, you get this same neurochemical pattern in response to depression until the brain says, aha, maybe we should retain a lower level of functioning right about here in the limbic area that controls mood. Magnetic stimulation shoots a magnetic pulse from an MRI magnet at a higher frequency to literally force those brain cells to fire at a higher frequency. And you do that 5 days a week for 6 weeks because it takes 4 to 6 weeks to upregulate brain receptors. So you're doing that to upregulate the activity. And at that point, the brain's going, oh, okay, new set point. Because, hey, we already made sure we had the neurotransmitters we needed. We already made sure that the vitamin levels are fine, the hormone levels are fine. So then we do that. And it's generally accepted as a permanent treatment to depression. I mean, if you've got somebody who's doing it and they keep going back and keep going back, then generally you have to start saying, okay, well, so what have we missed? But that's what magnetic stimulation is. It is FDA approved. It has been since 2008. Like I say, what's really great about it is 0 side effects. You just have to be willing to catch up on your movie watching because you're going to be sitting in that chair for 30 hours total. So, anybody else? Can what now? Motor tics. Well, mental illness. They can certainly be assigned to neurotransmitter issues. I mean, they have their own diagnosis in the DSM, so certainly the American Psychiatric Association considers them to qualify as a mental disorder. The problem is the etiology or cause of motor tics. There's so many things that can do that. Even just a side effect to a stimulant that somebody may be taking for ADHD, that I'm a little hard-pressed to make that blanket statement. So, you bet. Was there? Yes? Well, let me tell you, I mean, if it's a stimulant or a tranquilizer, you can know immediately. But I always get a kick out of, and some of you heard me say this earlier today, that my opinion of psychiatrists is that those who can't do teach, and those who can't teach go into psychiatry, just people in general. But it always amazes me that they'll take you in on say a 5150 hold. They'll take all the medications that maybe we've been trying to craft just right, and they'll wipe them all out. And they'll put them all back on new meds. And then in 24 to 72 hours later, they discharge them with a note that says stable on all meds. But if you ask those psychiatrists, how long does it take a medication to work, they will tell you 4 to 8, even 12 weeks. They'll say a minimum of 2 weeks to really see something. So how are they stable in less than 72 hours? All they did was give them a safe place, the milieu. It was actually just the environment, the structure. But being doctors, we always feel like we've got to do something. We can't just let them stay here and let them calm down. We got to be doing something. So, but I just thought I'd point that out. If you've ever not thought about that, if you have had family that wound up at the hospital, in a psychiatric hospital, and then they say, oh, come get them. They're stable. Meds are stable. No, meds had nothing to do with it. They just made my job a lot harder. So, anybody else? Yes. Oh, where do people collectively come from? Where do people collectively go when they die? And why are people collectively here? The one question nobody asks, and it's probably because it's obvious, you all know that, is why did I say that the Lord required us to exist in an adversarial environment? You all probably know the answer to that. Because if we were to follow some of those prosperity doctrines out there, if you have perfect faith, you're going to have health, wealth, and happiness, then that becomes a very selfish belief, selfish religion. Everybody's going to do it, and the Lord's buying your affection. But if you have a broken heart, pain in your body, tears in your eyes, and you still say, Lord, I love you, that means something. I'm done. I'm done. All right, thank you.